According to the American Cancer Society, nearly 1.7 million new cancer cases will be diagnosed in 2017. It affects men and women almost equally, and the Agency for Healthcare Research and Quality estimates that direct medical costs for cancer in the United States in 2014 was nearly $88 billion. Dr. Minetta Liu is with the Mayo Clinic, and she's here to tell us about the latest edition of Mayo Clinic's National Health Checkup, which does deal with cancer. Doctor, welcome to the program.
Thank you for having me.
It is our pleasure. Why did the Mayo Clinic decide to focus this latest checkup on cancer?
The Mayo Clinic chose to focus their fourth Health Pulse check on cancer because it's prevalent. There's so many people whose lives are touched by this cancer that we wanted to acknowledge and get a sense of the concerns that the Americans have about what cancer means, what barriers to care there may be, and what their beliefs are about prevention and screening.
Okay, so doctor, according to this survey, just how prevalent is cancer when it comes to being impacted? How many people are affected by cancer?
Approximately, or about 60% of the individuals who responded to our survey said that they were either personally touched or had a loved one that was touched by cancer. And when you think about it in reality, if you broaden that circle out to include coworkers, neighbors, people we know, that's probably about 100%.
Now, I think that when people hear about getting treated for cancer, there's definitely some concerns. What was expressed in the survey about cancer treatment?
The questions actually weren't directly about cancer treatment so much as they were about access to care. Would you feel comfortable going to a physician and talking about your symptoms? The great majority said yes. The barrier was actually getting to the physician, and those barriers related to time away from work and family, as well as finances or money.
Doctor, is there concern about being able to afford cancer treatment?
I think in this day and age, we're all concerned about the ability to afford care for any type of medical condition. I think that's a fear that we may have, but I would urge people to still seek their physicians out, develop a plan for treatment, and then deal with something real in front of you, because our concerns right now are based on the unknown.
Doctor, not many people know, or some probably should know, that there are vaccinations now for cancer. What are our attitudes about that?
The attitudes are mixed. We do have a vaccine to help reduce the risk of cancer, and that reduces the risk of cancers related to HPV, or human papillomavirus. Those cancers are of the reproductive organs and of the head and neck. Unfortunately, not everybody is getting vaccinated within recommendations. There are fears about vaccines in general. My hope is that people will understand the risks and the benefits, that although there are some small risks associated with vaccines, that those are balanced against the great potential benefit of reducing infections from human papillomavirus, and then secondarily reducing the risk of these cancers.
Are we doing a good job in general when it comes to taking preventative measures and getting ourselves screened regularly?
We are doing a good job in trying to do that, yes. Over 90% of the people who responded to our survey remarkably said that they were using at least one method of prevention. In other words, stopping smoking or not smoking at all, not drinking, sleeping well, eating and living a healthy lifestyle. And to do at least one of those activities is great. I would argue we need to do all of those. And it's not just about prevention and those activities, it's also about screening. I also think it's important that people don't feel that cancer is something that happens because they did or did not do something. We certainly want to do everything within our control to reduce the risk, but it doesn't mean that if it happens, it's our fault.
Absolutely great information. Doctor, where can we go if we want to learn more about this latest National Health Checkup?
Thank you for asking. Please check healthcheckup.mayoclinic.org.
Dr. Minetta Liu is an oncologist at the Mayo Clinic in Rochester, Minnesota. Thank you so much for spending a few minutes with us today.
Thank you.